Imagine getting world-class medical care for the price of a fast food meal. In Slovenia, a specialist consultation costs $12. In Taiwan, an MRI scan runs $35. These aren't developing nations with questionable healthcare systems. These are countries with better health outcomes than the United States at a fraction of the cost. But choosing the wrong country for healthcare can quietly destroy your finances or your long-term health without you realizing it. Most people assume quality healthcare requires emptying bank accounts or living in expensive Western capitals. That assumption is dead wrong. 7 countries around the world deliver exceptional medical care while keeping costs so low they seem almost fictional. But there's a twist that most travel guides won't tell you about these healthcare havens. Some of these systems are incredible on paper, but fail people badly in real life if you don't understand the fine print. Slovenia sits quietly in Central Europe, overshadowed by flashier neighbors like Austria and Italy. This oversight represents a massive opportunity. Slovenia's healthcare system ranks among Europe's best, yet costs remain shockingly affordable for international patients. A routine doctor visit costs $8 to $15. Specialist consultations run $12 to $25. Emergency room visits start at $30. These prices aren't for substandard care in rundown facilities. Slovenia's hospitals feature cutting-edge equipment and internationally trained physicians. The country's life expectancy exceeds that of the United States. Heart disease mortality rates rank among the lowest in Europe. Cancer survival rates consistently outperform regional averages. Slovenia achieves these outcomes while spending roughly 1/10 of what Americans pay for healthcare. This is why Slovenia shocks people who assume cheap healthcare always means compromise. But here's what makes Slovenia truly special for relocators. The country offers relatively straightforward residency pathways for EU citizens, and even non-EU residents can access affordable private healthcare immediately upon arrival. Private health insurance costs around $50 to $80 monthly and covers most procedures with minimal waiting times. The real kicker? Slovenia's location provides easy access to specialized treatments in neighboring Austria or Italy if needed, while maintaining those rock-bottom baseline costs. But the next destination makes Slovenia look expensive. Taiwan operates perhaps the world's most efficient healthcare system. This island nation delivers comprehensive medical care at costs that defy logic. A typical doctor consultation runs $3 to $8. Prescription medications cost pennies compared to Western prices. Major surgeries that bankrupt families elsewhere become affordable procedures in Taiwan. Taiwan's national health insurance covers residents and long-term visa holders, but even private healthcare remains incredibly affordable. Emergency room visits cost around $15. CT scans run $25. MRI scans cost $35. These aren't promotional prices or limited time offers. These represent standard healthcare costs across Taiwan. The quality standards match or exceed those found in expensive Western systems. Taiwan's hospitals consistently rank among Asia's best. The country's COVID-19 response demonstrated remarkable healthcare infrastructure and coordination. Life expectancy in Taiwan surpasses most developed nations. Here's the detail that changes how people see Taiwan's healthcare completely. The island nation actively courts medical tourists and international residents. English-speaking medical staff work throughout major hospitals. International insurance plans often provide additional coverage on top of already low baseline costs. Taiwan's visa policies favor skilled professionals and retirees with sufficient income. The Gold Card program offers streamlined residency for qualified applicants. But there's a catch that affects long-term planning, which becomes clear when examining the next destination. Thailand has transformed from a developing nation's healthcare system into a medical tourism powerhouse. Bangkok's hospitals now compete directly with facilities in Singapore and Hong Kong, but at dramatically lower costs. A specialist consultation costs $12 to $20. Routine procedures that cost thousands elsewhere run hundreds in Thailand. The country's medical tourism industry generates billions annually, driving continuous improvements in facilities and training. Many Thai doctors complete residencies in the United States or Europe before returning home. International hospital chains operate facilities throughout major cities, ensuring familiar standards for Western patients. Private healthcare costs remain remarkably low even by regional standards. Comprehensive health insurance runs $60 to $120 monthly. Emergency procedures that devastate finances elsewhere become manageable expenses in Thailand. A heart bypass surgery costs around $11,000 compared to over $100,000 in the United States. But Thailand's appeal extends beyond pure cost savings. The country offers multiple visa categories for retirees, investors, and skilled professionals. The Elite Visa program provides long-term residence for those who qualify financially. Medical visa categories exist specifically for patients seeking ongoing treatment. The lifestyle factor cannot be ignored when considering Thailand's healthcare value proposition. World-class medical care combines with tropical climate, low living costs, and established expat communities. But the next country offers something Thailand cannot match. Czech Republic delivers European Union healthcare standards at Eastern European prices. Prague's medical facilities rival those in Vienna or Munich, while costs remain a fraction of Western European levels. A standard doctor visit costs $10 to $18. Specialist appointments run $15 to $30. The country's healthcare system blends public and private options effectively. EU citizens access public healthcare immediately upon establishing residency. Non-EU residents can purchase private insurance starting around $70 monthly, providing comprehensive coverage with minimal waiting periods. Czech medical universities attract international students, creating a pipeline of globally trained physicians who often remain in the country. Research hospitals in Prague and Brno conduct cutting-edge medical research while maintaining affordable patient care. The combination of innovation and affordability creates unique value for international patients. Here's what sets Czech Republic apart from other affordable healthcare destinations. EU membership provides regulatory oversight and quality standards that match Western Europe. Medical degrees and certifications follow EU protocols. Patient rights and medical privacy protections meet European Union requirements. The country's central location enables medical tourism throughout Europe if specialized care requires access to facilities in Germany or Austria. But Czech Republic's own capabilities continue expanding rapidly. The real surprise comes with visa accessibility for non-EU citizens through investment and skilled worker programs. Up to this point, everything sounds perfect. And that's exactly where people stop thinking critically. Would you live in a country where appendix surgery costs $800 instead of $80,000? The next destination makes such scenarios routine. Portugal has emerged as Europe's most attractive healthcare destination for international residents. The country's National Health Service provides universal coverage, while private healthcare costs remain surprisingly affordable. Private consultations cost $20 to $40. Hospital stays run $50 to $80 daily. Portugal's healthcare system consistently ranks among Europe's top performers. Life expectancy exceeds European Union averages. Cancer treatment outcomes rival those of much more expensive systems. The country's focus on preventive care and community health creates impressive population health statistics. The Golden Visa program has attracted thousands of international residents who gain access to Portugal's healthcare system. EU citizenship through naturalization becomes possible after 5 years of residency. This pathway provides permanent access to high-quality, low-cost healthcare throughout the European Union. But here's the factor that makes Portugal irresistible for healthcare-conscious relocators. The country's private healthcare sector operates alongside the public system without creating two-tiered quality differences. Private hospitals maintain the same accreditation standards as public facilities. Many physicians work in both systems, ensuring consistent care quality. Portugal's appeal extends beyond healthcare costs to overall quality of life. The country offers excellent climate, low crime rates, and welcoming attitudes toward international residents. Coastal cities like Porto and Lisbon provide urban amenities, while smaller towns offer peaceful retirement settings. But the next country takes affordable healthcare to an entirely different level. Malaysia operates a dual-tier healthcare system that delivers exceptional value for international patients. Public healthcare serves Malaysian citizens at minimal cost, While private healthcare caters to medical tourists and expatriate residents, a private specialist consultation costs $15 to $25. Complex procedures cost thousands rather than tens of thousands. Malaysia's private hospitals meet international accreditation standards. Many facilities hold Joint Commission International certification, the same standard used by top American hospitals. English serves as a common language throughout the medical system, eliminating communication barriers for Western patients. The country's medical tourism industry has attracted significant investment, driving rapid improvements in facilities and services. Kuala Lumpur's hospitals now rival those in Singapore or Hong Kong for quality while maintaining much lower costs. Penang has developed into a regional medical hub specializing in complex procedures. Malaysia's visa policies favor international retirees and skilled professionals. The MM2H program offers long-term residency for qualified applicants. Medical visa categories provide extended stays for patients requiring ongoing treatment. The combination of accessible visas and affordable healthcare creates compelling relocation opportunities. Here's the insight that changes how people view Malaysian healthcare. The country's medical system operates at international standards while maintaining Southeast Asian cost structures. This combination typically doesn't exist in medical tourism markets. Patients receive world-class care without paying Western prices or accepting developing world-quality compromises. But the final destination offers the most surprising healthcare value proposition of all. Mexico challenges every assumption about affordable healthcare quality. The country's medical system has undergone dramatic improvements over the past 2 decades, particularly in major cities and resort areas. Private healthcare costs remain incredibly low, while quality standards have reached international levels. A routine consultation with a specialist costs $8 to $15. Complex surgeries that devastate finances in the United States become affordable procedures in Mexico. Dental work, in particular, offers extraordinary value with procedures costing 20 to 30% of United States prices. Mexico's proximity to the United States creates unique advantages for North American patients. Medical tourism flourishes along border cities like Tijuana and Mexicali. Patients can receive treatment and return home within days. For retirees, Mexico offers permanent residency options that provide ongoing access to affordable healthcare. The country's private hospitals increasingly meet international standards. Many Mexican physicians complete training in the United States before returning home. Joint Commission International accreditation appears throughout Mexico's major medical centers. The combination of proximity, quality, and cost creates unmatched value for North American patients. But this is also where many people underestimate wait times, coverage limits, and what isn't included unless you plan properly. But here's the revelation that makes Mexico's healthcare system truly remarkable. The country offers healthcare costs lower than any other destination mentioned, while maintaining geographic accessibility for United States and Canadian residents. This combination typically requires choosing between cost and convenience. Mexico provides both. For deeper insights into relocating to any of these healthcare havens, including detailed cost breakdowns and visa requirements, consider joining the Horizon Society School Group, where comprehensive relocation guides await. These 7 countries prove that world-class healthcare doesn't require world-class prices. Slovenia offers European Union standards at Eastern European costs. Taiwan delivers comprehensive care at prices that seem impossible. Thailand combines medical excellence with tropical lifestyle advantages. Czech Republic provides EU-regulated healthcare at affordable rates. Portugal offers pathways to permanent European residency with excellent healthcare access. Malaysia delivers international standard private healthcare at Southeast Asian prices. Mexico provides proximity and quality for North American patients at unbeatable costs. The pattern across these destinations reveals a fundamental shift in global healthcare accessibility. Quality medical care increasingly exists outside traditional expensive Western centers. Technology transfer, international training programs, and medical tourism investments have created healthcare excellence in unexpected locations. Each destination offers unique advantages depending on individual circumstances. Europeans benefit from Slovenia's EU membership and geographic convenience. Asia-Pacific residents find Taiwan's comprehensive system ideal for long-term healthcare planning. Thailand attracts those seeking tropical climates alongside medical security. Czech Republic provides Central European access with Eastern European pricing. Portugal offers EU citizenship pathways and Mediterranean lifestyle. Malaysia combines English language healthcare with Southeast Asian costs. Mexico delivers proximity and affordability for North American residents. The visa and residency requirements vary significantly across these destinations, but each offers pathways for international residents seeking long-term healthcare access. Investment visas, skilled worker programs, retirement visas, and medical tourism categories provide entry options for most situations. The real question isn't whether these countries are affordable, it's whether you can afford to ignore them. Which option feels most realistic for your circumstances? The financial implications of accessing these healthcare systems extend far beyond immediate medical costs. Long-term savings can fund better lifestyle choices, extended travel, or enhanced retirement security. The difference between paying Western healthcare prices and accessing these affordable alternatives often equals entire annual budgets in retirement. The misconception that affordable healthcare requires accepting substandard care has been thoroughly debunked by these 7 examples. International accreditation standards, globally trained physicians, and modern medical infrastructure create healthcare excellence at sustainable costs. Ready to explore your options? Check the description below for complete cost breakdowns, visa requirements, and step-by-step guides for each destination. The Horizon Society School Group provides comprehensive resources for planning your healthcare relocation, including insider tips from successful relocators and ongoing support throughout your transition. World-class healthcare at affordable prices isn't just possible, it's happening right now in these 7 remarkable destinations. The only question remaining is which one fits your lifestyle and budget best.